Hi, this is Viv with the Medical Ancillary Sales Podcast. Today we're giving you a sneak peek into the next episode of our doctor-focused Medical Practice Trends podcast, where we explore the field of neuroscience.
Today, we're pleased to welcome John Armstrong, who's the Executive Vice President of Sales for EVOC Neuroscience. EVOC Neuroscience has a terrific new system that's a non-invasive aid for the diagnosis of memory-related biomarkers for cognitive diseases at the primary care level. John, thanks for joining us.
Well, thank you, Michael. Thank you, Vivian.
John, can you tell us about what the EVOC system is? What does it do?
Yeah, thank you. The EVOC system's a medical device. It's 510K approved by the FDA, and it's designed to perform really a lab test for the brain, which will aid physicians in the diagnosis of cognitive disorders. So a physician would run this on their patients. Primarily, most physicians use it for early memory loss, mild cognitive impairment. And the reason why they do this is because it's an objective test. It's highly sensitive, and it can pick up memory loss and cognitive decline as early as 10 years that what might appear on a physician's MMSE or a mini-cog. So it's going to report on biomarkers that correlate to this cognitive decline. And this is from quantitative EEG, brain processing speed, S-Loretta, EKG, believe it or not. And all this is going to be put into one convenient test, and the doctor can read this test, interpret it, will help them make a diagnosis, and it will help them create a great treatment protocol that helps the patients.
So how does this compare, or how is this different to what doctors are currently doing? So I think I heard you say that they do like some mini self-assessments, but obviously what you have is a lot more detailed.
Yes, the standard battery, if any of us went into a physician's office and said one of our loved ones had memory loss, or we believe that they might, the first thing they're going to do, besides doing a patient workup and all the appropriate lab tests, is they're going to administer what's commonly known as a MiniMental state exam, or a clock draw, or a MoCA test. And all these tests are pen and paper tests. They're subjective, and it allows the patients to go through a standard, report that reports on memory loss. And what's interesting is they do have some degree of sensitivity and specificity to them, but primarily they're focused on later stage memory loss. And at that stage, typically doctors are left with the options, many times, not always, with prescribing Aricept, Exelon patch, or even Namenda. And so our system, the competitive advantage that it has over what the doctors are currently using, is that it will pick up memory loss and cognitive decline as early as 10 to 15 years, prior to them presenting on one of those tests. And that gives the physician the ability to begin to ask the patient to make lifestyle changes, therapeutic lifestyle changes that could potentially affect their progression towards Alzheimer's disease or similar memory impairments.
And how is the physician going to benefit?
Well, the physician gets the benefit of identifying it, and number one, so it makes them the hero in the office. If the doctor can change the course of the progression of memory loss for a patient, that's remarkable, because having Alzheimer's is almost a guarantee that once they use the drugs, the package insert themselves will tell you they only last for about 6 months before you start to see a remarkable decline in efficacy for all the drugs. And so by intervening early, it allows that doctor to change the course of somebody's life potentially. And just the cost of having Alzheimer's disease, especially moderate or severe or debilitating for a family. So it puts the doctor back in the seat of helping the patient and potentially changing the progression.
I think it's one of patients' worst fears is like everybody wants to still have their marbles kind of when they go. So to be able to hear that patients can benefit as soon as 10 to 15 years earlier than what a normal diagnosis would be is a huge asset. So I can see that there is some benefit there to the patient, but what is the real tangible benefit? So how are they then treated as a result of this testing?
Well, there's a whole host of doctors now in the specialties of functional medicine and integrative medicine. These are, in many cases, primary care physicians, but they could be from any discipline, quite honestly. And what you're finding now is it's very, very popular for physicians to follow a couple protocols. There's many out there. One that's very popular right now is Dr. Dale Bredesen's RECODE program. And then Dr. Daniel Amen has a Bright Minds program. And these are multifactorial. They believe the disease state's multifactorial and not due to one single event. And so they're running a battery of lab tests that are phenomenal. They're going very deep, and their whole objective is to identify, number one, does this patient have inflammation, or is there something contributing to it? Does this person have the correct nutrition that's going to help this person? And lastly, is there any toxicity that they could eliminate? So for an example, if you're constantly consuming too much sugar, this could lead to inflammation, and that's a problem. Another example is if you're not, let's just say you have a severe vitamin B12 deficiency. The doctor then has the ability to prescribe medical food like serifluin. Or it could be perhaps they have cerebral glucose hypometabolism, where the brain's not able to truly metabolize carbohydrates, and they have to go to a ketotic diet, in which case there's a whole host of products out there. And lastly, some patients just simply have a toxicity to too much zinc or some other type of perhaps infection that's not been treated. And all these will show up for doctors on a variety of tests. And those tests are later stage. They include PET scans or SPECT studies. By using the EVOC system, it's in-office technology that's non-invasive, inexpensive. It does create a profit center for the doctor, but most importantly, it gives that doctor clinical information that will allow them to quickly identify whether the patient's on track and give them then the option to go down any therapeutic path they choose as necessary for the patient.
John, I know this is geared at the primary care market, but have you worked with any other specialties that have found this system useful?
Good question. Yes, there are pain physicians that like to use our system. As you know, there's an opioid crisis in the United States, and right now patients are coming in. They're looking for opioids or other pain-covering medications that are addictive. And our system, through three of its measurements, really gives the doctor the ability to identify whether or not the patient in fact has pain or not. And this gives the doctor some type of comfort knowing that if they do, write a medication that could be addictive, that they're sending it out for the right type of patient. Also, this technology is very popular to identify pseudo-dementia, so what appears to be dementia but is in fact depression. It identifies very easily concussion and traumatic brain injury, whether that be from a blast injury from a returning military soldier from a war zone, or it could be an automobile accident or even an MMA fighter. So right now out there's tests such as the impact test, which are very easy to identify concussion, but the real question becomes, when's it time to return to play to the sports game, or when are you in fact healed? And that's a different issue. And so you feel better symptomatically before you physiologically are better. And our system will give the doctor the ability to identify when that patient is ready to return to play. And that's significant.
So what insurances accept this testing? And from what I understand, there's about 6 billing codes. Is that correct?
Yes, there are 6 CPT codes that are commonly used. And Medicare does cover our test, as does commercial insurance plans. It's not so great in the Medicaid department, and so it reimburses much less there. So the real target audience is really Medicare and commercial plans. And as everybody knows, in the beginning of the year, there's obviously a lot of deductibles that have to be met. So you find physicians really using our tests more often than not, beginning later February and on throughout the rest of the year.
John, the benefits seem clear. It's insurance reimbursable, but is this going to be a big disruption to a practice? What type of ongoing training or support are you guys going to lend to that practice?
Yes, good question. I'll answer really two questions here. The first is it disruptive? So the test it's a 20-minute test and the bandwidth is 45 minutes. You don't need a separate room, although a separate room is helpful. And what we find is that you can really sit at a desk and it doesn't have to be a quiet room for this test to be successful. So it's only disruptive if the doctor doesn't have an MA that has free time or some type of even non-healthcare provider staff that can run it. Anybody can learn it. Even somebody new can learn in about 30 minutes how to run it. But the second question is the training. So there's 3 levels of training. Foremost is you have to train the tech to run the system, which, as I said, takes about 30 minutes. But second, the physician has to learn what the technology is, the background on it clinically, how to interpret the report, and then how to communicate the results to the patient or patient caregiver. And so we've got training for that, and that's typically just going through some online training, reading it up, reading the information initially, and then spending about 30 minutes to an hour with one of our associates. We have 3 PhDs on staff who can really walk them through the technology and the report, and then how to communicate this and role play what you might say to order the test with a patient, to how you might communicate the results when they come back. And then lastly, the billing and coding is always a big educational item for the practice. They want to know how to do this right and maximize their investment. And so we provide a consultant who participates in that training as well.
John, thanks for joining us.
Thank you. Have a great day.
Thanks so much.